So on this side, I will show an alternative approach. I will palpate the temporal crest, which is over here. Temporal crest over here. And it's kind of a little bit broader than my line just there. So it's about this. Let's feel it. Yeah, it's over here. It's not very well defined. Usually it's a bit clearer where the temporal crest is. But from the temporal crest, we have an anatomical boundary between the frontal area and the temporal area. Of course, the temporal area is limited by the zygomatic arch and the lateral orbital rim. And if we want to treat both, we could use an entry point. Just, let's say we have to watch out for this little superficial blood vessel. So I would say about here we could go in. And from here we can treat both the frontal area and the temporal area. And so from here we can treat in this area and in that area, in that direction. So I will start by giving a little blab of anesthesia. 1, 2, 3. Over here. Then I will also anesthetize the temporal artery by block, about 0.5 mLs lidocaine, and then I will give her a supraorbital block as well. So it's over here, I go in here, 1, 2, 3. Okay. That should block the supraorbital nerve. And I will use diluted radius. All right, entry point. So start with a entry point lateral to the temporal crest. Lift up the frontalis muscle and the galea and go underneath the galea. 1, 2, 3, click. I'm through. I advance the cannula over the periosteum. If there's any resistance, I just go back, maybe rotate a little bit until I can get through. Then I place a little bit of product. Just little bits is enough. This is diluted calcium hydroxylapatite. In this case, it is 1 ml in 0.8 ml. So that restores nicely the convexity of the forehead. Now I'm going to go up along the temporal crest, and always I'm staying in the supraperiosteal level, so I'm not going superficial. And then from the same entry point, I move to the temple. So, okay. So from here you could go either subcutaneous or you could go one level down, just below the temporoparietal fascia, like I'm doing now. So there's a resistance you need to pass, and there's strange noises that the patients will hear. But this is a very safe space between the two fascias. No danger zones here, no superficial temporal artery. So definitely very safe place to be. No middle temporal artery. Just a potential space. can see a small distension of the veins here, so it's absolutely normal to see a little bit of distension of the superficial blood vessels due to increased pressure. And I have a little bit left, I think. As you can see, she probably needs some over here. I'm going to give her a bit more. Thank you. Again, going down to the subgaleal space. And then evening it out. There we go. So again, I go below the superficial temporal fascia. And I'm also even treating behind the hairline, which will give her not just a lift, but also it will create an image of fullness of the hair.